When we prepare for a hurricane, we often think about food, water, and the shutters. But what about our loved ones that need extra care? Joining me today is a family physician and the Director of Non-Communicable Diseases at the Ministry of Health, Dr. Maria Clapperton. Dr. Clapperton, thank you so much for joining me today.
Thank you for having me, Kerenda.
We will be talking about how we can help our dependents during adverse weather. When preparing for a hurricane, Dr. Clapperton, how far in advance should persons stock up on medication?
Well, usually we like to advise persons with chronic medical conditions to stock up on at least 2 weeks' supply of their medication so that they can have it ready in the event that clinics and pharmacies are closed or rendered inaccessible due to the natural disaster.
And what will be a safe amount for them to have on hand?
Well, in terms of the amount, we wouldn't really quantify. That is usually in relation to the prescribing dosage and frequency. So according to the prescription and requesting a 2-week supply of this medication, the pharmacies will be able to dispense and advise accordingly.
And why is it important for us to keep an updated list of all of our illnesses, our doctors, etc.?
Well, for persons with chronic medical conditions, it is good to have a prepared list in advance of the names of their diagnoses, the names of the medication, the dosages prescribed, and also a prepared list of their doctor's contacts, because time would be of the essence in the event of an emergency. So you'd want to ensure that medical personnel rendering assistance to these patients would be able to have this kind of information readily available.
One other thing, so should it become so bad that I now have to evacuate and go to a shelter or go to somewhere that's much safer and take along my elderly dependents with me, or my children, or someone that has special needs, what should I pack in a go bag?
So in your go bag, apart from packing your supply of medication, we'd want to advise you to pack a first aid kit. You'd also want to put a flashlight with batteries, pack your personal hygiene apparatus, as well as face masks and hand sanitizer. And actually, as a rule of thumb, you may want to ask yourself, what is it that my family can't go a day without?
Okay. Should lines of communication be down? What role can relatives or neighbors play in reaching out to those elderly persons that may be living alone?
So friends and especially neighbors are your first line of contact. So it is good to prepare in advance and to know the elderly and persons with disabilities in your family and neighborhood, and ensure that after the storm subsides, you check in on those persons, because just spending a little time and checking in can save a life.
Now, those are some tips for before the hurricane. Now, during the hurricane, we know that it can be very distressing. So what are some of the things that caregivers can do to help keep these persons calm?
So in terms of keeping children calm especially, children will reflect, the mood and the behavior of the adults. So be mindful as the adult to ensure that you remain calm and that you give clear and very simple instructions to the children. You'd also want to ensure that you keep them distracted and well entertained. So tell a story, sing a song, or play games with them as well. So the same advice in terms of remaining calm, to keep the persons calm. The elderly persons are going to receive your energy if you are anxious as well. So remain calm and give them clear and simple instructions.
Okay. And during the hurricane, some persons may be dependent on specialized medical equipment. What precautions can you give to their caregivers on these medical equipment that may die of a battery loss or may not be able to be charged, etc.?
So persons with chronic medical conditions who require the support of an electronic medical device on a daily basis, you would want to ensure that they have a backup power supply, and they can go even further, the caregivers, to notify the nearest health facility so that they are aware of these individuals, for example, if it's an oxygen supply machine, so that they are aware and can prepare in advance in the event of a natural disaster.
Okay, great. So thank you so much for those tips that we can use during the hurricane. Now, after the hurricane, the storm has passed, everyone is trying to see what damages have been done, etc. Once the storm has passed, what are the first health checks a caregiver can do with their elderly or with their dependents who may have special needs or young children?
So for these individuals, you'd want to check to make sure that, if there are any injuries, you'd want to examine and look for injuries. If there are wounds, you'd want to keep them clean, as well as you would want to ensure that those with chronic medical conditions continue to take their medications on time. And overall, you'd want to keep the elderly and children and those in your care, keep them safe and well hydrated.
Now tell us, why is food and water safety a critical issue, especially for the elderly and for young children?
So for persons at the extremes of age, like children and the elderly, contaminated food and water supply, the illnesses that they can get from the contaminated food and water can result in severe illnesses. So you'd want to ensure that you boil your water and avoid using any spoiled or contaminated food.
How can a caregiver give their loved ones some sense of normalcy after a storm has passed?
So in the event of a natural disaster, when the storm subsides, maintaining a routine schedule can be healing in itself. So you'd want to try to maintain a daily routine, regular mealtime schedule, ensure that they take their medications on a scheduled time as prescribed, as best as you can, and you'd also want to probably keep a bedtime and just, provide a listening ear, be empathetic, and give reassurance.
Now, if medical help is needed but communication is down, or conditions are difficult to get to a medical healthcare center, how should families know where or who to contact?
So it's important to have some means of receiving communication, and so that you keep up to date with official sources of information and official updates, for example, from the Ministry of Health and the ODPM, so that you are aware of your nearest emergency health facility, and also in advance prepare a list of emergency contacts.
Thank you so much. Now, Dr. Clapperton, that concludes all of our questions that we have for you. You have touched on what to do before the hurricane, what we can do to keep our loved ones calm during the hurricane, and some of the tips that we can exercise after the hurricane, such as making sure that we boil the water before we drink it, ensuring that we stay in contact with our emergency care personnel. And we thank you for providing us with these tips, and we hope that they would be beneficial to all of our viewers.
You're most welcome, and thank you for having me.